I feel amazing, like a bride on his wedding day. At last.
Stretched out skin, what not to do as a parent, and a whole bunch of selective surgeries. Get ready to laugh because today we are breaking down and reacting to all of the funniest medical scenes that Family Guy has to offer. Let's dive right in.
Hey, any of you know how to tie a tie? I have to go to a patient's funeral.
Luckily, as an ER doctor, we don't use ties. Somebody could use it against us. And that's also why even police officers, when they have a tie on, it's actually a clip-on. That way it breaks off right away.
Peter needs to lose weight, and we were hoping you could help us.
Sure, there are a few options we could try. You can increase your exercise. Pass. Switch to a vegan diet. I'd rather die. Or quit drinking.
Exercise is really good for you.
It's good for you!
Good for your heart, good for your muscles, good for long-term health. But typically you can't exercise out of a bad diet. With the majority of us, if you want to lose weight, you have to reduce the amount of calories that you're getting in your body. And then obviously alcohol, there's actually no true health benefit to alcohol. That's why if you do stop drinking, you actually lose weight pretty quickly.
What did Honey Boo Boo's mom do? We have a similar workout.
I'm a beauty queen.
She had lap band surgery. If you're interested in that option, the hospital is running a promotion where it comes with a free Nintendo Switch.
Oh my gosh. They put a band around your stomach to make your stomach smaller so that way you can't ingest as much food. Most doctors require that you actually show that you're starting to reduce your own weight by the normal steps of, reducing calories, exercise, watching what you eat. You don't want to have the surgery and then not have any lifestyle changes. Whoa, hey. You don't lose weight that fast, and you don't want to lose weight that fast because then you have a lot of excess skin.
Okay, so if I got like more skin,
it hasn't had the time to tighten back up, and then you're gonna potentially have to have surgery again to have a skin reduction.
I feel amazing, like a bride on his wedding day. At last, my love has come along.
The skin is still innervated, meaning it still has sensation. So you're gonna be dragging that around on the ground. You're actually gonna feel it. It's gonna feel weird, awkward, and maybe even painful.
I can taste the floor.
Decided to try that radical penis enlargement. Peter, I don't think...
Brian, your objections are duly noted. Now hit the gas.
Whoa, don't do that. Oh! Do not do that. You are gonna cause massive amounts of bleeding. Literally, we'll have patients who have Foley catheters, and they'll try to rip those out, and the amount of blood that comes out, and the trauma and the damage, you can have major urethral injuries. No, you don't want to do this.
You know that would never work again in a million years.
Don't need it to, Brian.
There is surgery out there. They do penile transplants for people who've had trauma to their penises or severe cases of micropenis, but please do not attempt any of this that you see. What? I don't know where this scene is going, but at least there was some blood. So I'm assuming they wanted to be in a blood vessel giving this injection versus when we do an intramuscular injection, we don't want to see blood when we draw back.
Okay, Mr. Griffin, now you've got your flu shot.
Will you stop giving him flu shots?
People will have an immune response to a vaccine because they're reacting to something foreign in their body. Sometimes people feel fatigued, body aches, weakness versus having euphoria like Peter.
It's cool. It's cool. This is the doctor that killed Michael Jackson.
So Michael Jackson was getting injections with propofol, the medication that we use in the emergency department for sedation. A lot of the big side effects that we see with propofol is actually hypotension. So you can actually decrease blood pressure significantly. Oh geez. What's the matter, Chris?
Peter, I'm really worried about Chris. The shock of seeing Arthur Valentine die seems to have really gotten to him. I've never seen him so depressed and catatonic.
Catatonia, basically when somebody's awake, breathing, but non-responsive in the sense of not talking, not being aware. There's multiple different reasons why this occurs, and a lot of times it's somebody who's seen something traumatic.
In Awakenings, Robin Williams tossed a baseball to Robert De Niro, and he snapped out of it and caught it. Maybe we do that? Chris, you doing okay?
Oh, jeez. He's gonna hit him, I know.
We thought we'd... Awakenings!
Peter, I'm not sure that's
Oh my gosh. You're going to cause a jaw fracture, hematoma, fracture of the inferior socket of your eye or your maxillary sinus here, all the bones.
What if I try it with a basketball?
No.
Oh,
Oh my
Oh, God, that
gosh.
broke his nose.
I feel like the baseball would actually do more damage than basketball. Two major areas of the nose. One that's in the back and it's dealt with major blood vessels back there. And then in the front, it's on your nasal septum and it's called Kesselbeck's plexus.
He didn't even flinch. It's bad. Let's do your thing. Let's twirl some toilet paper up into his nose, and then we'll do your thing.
Sticking some toilet paper or tissue up the nose, people do all the time, but you need more compression. That's just gonna soak it up. Compress the area, hold it there. Pressure is your best bet.
It's about my dad. He wants to have a sex change operation.
Typically, if somebody's having this type of surgery, probably do hormone therapies. Some rules require that you live for a year as the gender that you identify as. You just don't want to get into a situation where you're having major surgeries, you're removing organs, and then all of a sudden you want them reversed, and you get into a situation where you actually can't reverse those processes.
He has an appointment Friday with Dr. Hartman to have the procedure, and he wants me to go with him.
I thought he was like a family doctor. Typically, surgeon's a surgeon, and there's subspecialties within surgery. Then you have like family medicine doctors, internal medicine doctors that do general medicine practice. Then you have myself, emergency medicine doctor, who does emergencies.
Here's the deal. Anything he lops off, we get to bring home for Brian.
What? I've not been privy to any of these type of surgeries. It is definitely not like a restaurant where you get the leftovers and the bones to go, and so you can give it to the animals at home.
Wow.
You wouldn't literally go out to see family with blood all over you, wash yourself, change your clothes. Like, no, they don't want to see that.
That thing was on there.
That thing was on there. Yeah, it's part of the anatomy of a human being. And penectomy is actually the word for penile removal. The biggest things you worry about are the blood vessels and the nerves.
How is he, Doc? Is he all right?
No, I'm afraid not. But she's gonna be just fine.
There you go. I mean, that was the fastest surgical recovery ever. Typically, no, you'll end up going to the PACU. The after surgery care unit will have the anesthesia wear off, make sure there's no excess bleeding.
What do you think, boys?
I'm walking on sunshine. Whoa!
It's great that Quagmire is supporting somebody who's having this choice. You want family support. I think that was a good depiction, even just in this scenario, even though Peter's kind of making a little bit of a joke about it. I really enjoyed this. These were actually really good medical clips from Family Guy that allowed me to discuss what actually happens in real medicine. So that was awesome. If you guys really like that, definitely check out this playlist right here. Definitely binge watch it for me. Make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.